Madam Administrator,
Yes, Madam Chair.
are we all set?
Let me hit the recording button and then you're ready to go.
All righty.
No, thank you.
I think I already have those. I already have them. Good morning, everybody. Commissioner, you want to come on up? We'll start with you today. Nice to see you. I don't know if you just want to, if you have anything that you want to say, or you want to go right into questions, how you want to do this.
Yes, I can start with introductions and
That would be great.
thank you. And then we can certainly do questions. So my name is Amy Porter. I'm the Commissioner for the Department of Aging and Disability Services. And I have with me.
Good morning, Jasmine Berry, Fiscal Administrative Manager for the Department of Aging and Disability Services.
Is your mic on there? You gotta hit that button right in front of it. There you go. Now say it again.
Thank you. Good morning, Jasmine Berry, Fiscal Administrative Manager for the Department of Aging and Disability Services.
All right.
Great. And we're happy to be here today to talk about House Bill 5048, an act adjusting the state budget for the biennium. And we're happy to answer any questions that you have.
We're happy to be here.
I'm not positive that that's true, but we do like being here though. So I have a couple questions. So I've been hearing some scuttlebutt about returning a position that used to be within your agency, having to do with deaf services. Did you used to have someone that was responsible for overseeing deaf services, interpreters and other things a number of years ago?
Yeah, when we were consolidated back in 2011, one of the programs that became part of our agency was the Commission on Deaf and Hearing Impaired at the time. So when the consolidation happened, the executive director position was eliminated. And so the programs, the counseling program and the interpreting program are what came over to our agency, which is now Aging and Disability Services.
So one of the things that I'm hearing relative to that is that there's been some loss in interfacing with the deaf and hard of hearing community, that they are saying that we used to be able to have real conversations with somebody that was overseeing the services broadly. And they made sure that if someone called in, they would know, gee, I'm going to the doctor. I need to have somebody that helps me out with an interpreter for that, or points me in the right direction to get an interpreter for that. Someone gets arrested and they're deaf or hard of hearing, and they need to have someone interface with between them and the criminal justice system. And that's a hard one because that might happen in the middle of the night, you know.
Right.
Do you have any suggestions, or what is your comment on that particular issue?
Yeah, I think there are a number of challenges in the deaf community around access. And we do have a position that actually the legislature in the budget and in partnership with the governor added a human services advocate position to address some of those issues, to help individuals who are deaf or hard of hearing or deafblind to figure out how to navigate the system. And so we do have that human services advocate position. We also have somebody who works with individuals who are at or below the poverty line, funded through the social services block grant position. And then the interpreting services are sort of spread throughout private agencies throughout the state. And it's up to the individual agencies to be able to help navigate for what type of interpreter, how many interpreters somebody might need.
So different agencies sometimes don't think it's important because this population is small in number, but mighty in need.
Right.
And so I think that that's something that we really need to start looking at. We used to have OP&A that was more robust in helping people with disabilities, in particular, the deaf and hard of hearing community. We have even started having deaf interpreters that are talking about what's going on in our public hearings. So I think that that's important because the more we can do, the more we'll bring in people from a community that long gets left off to the side. So I'd like to look at that in the subcommittee and make sure that we are, and so if you want to bring any information to the subcommittee on this issue, I think it's important for us to do so.
Yeah, thank you. We can do that. I'm an active member on the advisory board for persons who are deaf, hard of hearing, and deaf-blind. I was co-chair for the first couple of years, and then we wanted to make sure that the co-chairs for that committee were actually individuals from the community. So now I am a sitting member on that, and that group is particularly interested in these issues and access issues and trying to find the best way to come up with a solution that works for everybody.
Thank you. Representative Walker?
Good morning.
Good morning.
It's great to see you and thank you for coming to testify. And I want to sort of go back to last year and see where we are with some of the initiatives that we had and going. So my first question is the money that we put into the budget last year for elderly nutrition. Can you tell us where we are with that right now and how things have been going? Because we hear a lot of needs when it comes to the elderly nutritional requirement.
Yeah, we appreciated the additional funding for the elderly nutrition program. We all know that that's something that that nutrition's critical, particularly for our older adults. So last year we received 2.25 million from ARPA dollars for the first year of the budget. 750,000 of that went directly out to the elderly nutrition providers. They can use that for capital expenditures, emergency meals, or any increased COVID costs that they had. And then 1.5 million went to the area agencies on aging for meals, because the elderly nutrition providers are selected through a competitive procurement process done by the area agencies on aging. So we fund the AAAs then do the RFP and fund the elderly nutrition providers. So the 1.5 million went out to the area agencies on aging for that. And then the second year of the budget provides state funding so that they get the same level funding moving into this next state fiscal year.
Have they given you any report or anything like how they're doing distribution wise? Are they having any glitches? I want to, up to this point, have you gotten any information on any problems or how things are going? How many people have gotten distribution or anything like that?
Yeah, there was a task force recently talking about some of the issues with the elderly nutrition program. You know, there's a huge demand out there, but it is not an entitlement program. We have a certain amount of funding. That amount of funding goes to the elderly nutrition providers, and they need to work within that budget and figure out how many meals, how many days a week, what they're able to provide with the funding that they receive. So as I said, it's not an entitlement. So we can't keep scaling up to meet the need. We have to figure out, we know what our budget is for this year. We know what it is for the coming fiscal year. And I think there's obviously interest in being able to provide more support from the elderly nutrition providers because they see the need there, but there are a lot of needs in the state. And so I think we are trying to address that by adding the additional 1.5 million in the state budget for next year to bridge that gap.
Could you bring to the working group a breakdown of how much we did with the distribution with the 2.5 million? You know, the 750 and then the 1.5 in that went out to the area on aging. We'd like to know how many people is there a waiting list out there? Just to give us an idea of if this was adequate or if we need to do more in that area, because it's very important for us to address that. So I'd appreciate that.
Yeah, we can provide the most current data that we have.
My second issue, I know this is not my second question. I'd like to know how are the distribution to the senior centers going, and where are we with that? And how many people are, because I know it's been a slow walk. So where are we now and where can we help? And what districts and what areas? If you'd like to bring that to the working group, if you have the information, I think you knew we were going to ask you this question. So
Yeah.
I'll go right ahead. Go ahead.
We anticipated that you might ask about that, and we appreciate your interest in senior centers. We all know that they're really a foundational organization in our communities. So we have obligated funds, but as you said, it's going slower than we anticipated it would. We've received 54 proposals, and we have 34 beneficiary agreements executed already and the other 20 in process. But there are a lot of towns that haven't applied at all. And so we would love your input on how to engage more towns, how to engage the town managers or the municipal agents, the senior centers themselves. So maybe that's something we could talk further about at the working group. Our senior center liaison has been communicating with the municipal agents. She's going to start doing office hours every Friday just to
Right.
help walk people through the application, which is not that difficult, but I think some folks just aren't sure what to do with the funding. So we're going to start that process, and we're happy to listen to any ideas that you might have, because we want to make sure that funding gets into our communities.
So you made a very interesting statement. You said you received 54 proposals. When we put the money in, I didn't know how they were going to access it, but now I see it. So they have to give you a proposal that says how they're going to spend the $100,000?
They have to submit a proposal so that it's consistent with the Treasury guidance, so that we make sure that we have the guardrails up to get the ARPA funds out in a way that it meets the Treasury guidance.
And could you just brief us quickly on what is the Treasury guidance on that?
I can, I don't know if you have.
We've heard several Treasury guidance. Some are that things are reimbursable, some get access to the funding early. Some have to get authorization through other means. So that's why I'm
Yeah,
asking, what were the Treasury guidelines for you?
we did try to make it as flexible as possible within the guidance, but we could bring that to the working group and walk through it with you, walk through the application. So it sounds like the two major categories were capital improvements and programming.
Okay. I would appreciate an update in how they did it, because
Right.
when we go back and talk to our senior centers, a lot of them don't have someone who is able to write the grants. So we may end up helping them. And two, when we go in, we want to know what they have to have in order to make the application too. So it helps us in working with the groups on here. So
Sure.
you said capital improvements and the other one's
Programming. So we could walk through the application with you. And as I said, our senior center liaison is going to be doing office hours, so she can help people if they have ideas. She can help walk through the process. It might look a little more intimidating, but looking at the application, once you actually walk through it, it's not a lot of information that they're looking for.
Not that I'm talking about aging, because I'm old, but I've met with some of them, and some of them are stymied. So we just
Yeah.
need to make it a little bit more simplistic. for 'em.
Sure.
Thank
And
you,
we're
thank you.
eager to help.
Thank you, Madam Chair.
Julie?
Thank you. Good to see you.
Good to see you as well.
Was hoping you could speak to us about the ombudsman program, just what we did last year, and then where you all want to go in this proposal, and how many in total we have across the state. Because I believe last year's ask was larger than what we ended up providing. And so just want to know where we're at.
Great, thank you. Our ombudsman program is a critical program for us. And so we do appreciate that this year's budget does add, in the proposed budget, there's an additional position for a community ombudsman. And we also had a position last year for an ombudsman. So in the community ombudsman program now, so each year there's been an additional commitment by the governor and the legislature to grow that program. So we have a manager, a community ombudsman, and a third position that is now proposed in this year's budget for the community side. And then our regional ombudsman program has our state ombudsman, has 3 intake staff. And how many? 8 regional ombudsman. I'm sorry, it's 2 intake staff and an administrative assistant.
Great, thank you.
Thank you.
Any other questions? Representative Dathan?
Good morning. Thank you, Madam Chair, and thank you, Commissioner, for your presentation. Just wanted to follow up on Representative Gilchrist. Started my question, but my question really is a follow-up. One of the things we talked about last year was kind of the ratio of number of cases per ombudsman to ensure we have adequate coverage. I have had the luck to have a good relationship with Marie Painter, the ombudsman that we have, and really got a good kind of understanding of where we are as a state in for these ombudsman services. I know this one that you're talking about now is for older adults and individuals with disabilities, and just want to make sure that we're doing something that is also in line with our OPM sort of advocates that we have that are working with folks with developmental disabilities, as well as the person who's working with the autism. So if you could provide kind of a case analysis of those ombudsmen, that would be really helpful. And then my second question is really when we talk about kind of COLAs and how things are kind of going up, particularly in the amounts that folks are having to pay for services. And I'm just a little bit concerned that we have staff at our private providers. And with those increasing costs, are we hurting our workforce by not giving our private providers enough money to employ the people that they need to get the services done? So if the agency has any sort of data on, employment figures for their private providers, as well as the number of folks that are treated, I'd greatly appreciate that. Thank you, Madam Chair.
Thank you. Any other comments or questions? Representative Garabay?
Hi, can you tell me how long it takes you to respond to someone when they call and they complain? When they have a complaint, how long does it take you? I know it was 24 hours, but I know that has changed.
Just for clarification, are we talking about a specific one of our programs in ADS?
The nursing home, I'm sorry, nursing home complaints through the ombudsman's office.
Sorry, I was just checking with our state long-term care ombudsman, Marie Painter, who is here with us as well.
Right.
She said it has increased to a couple of days because there is a demand. And so they're getting a lot of complaints, and so it can take a couple days to respond.
Right. So what would full funding look like? Or developing a plan to add, et cetera. What does full funding look like in both the home care and the nursing home for the ombudsman's office?
I think that's similar to the question that Representative Dathan asked. So we can try to do an analysis and bring that to the working group to provide some additional information.
Okay, I didn't hear that. I apologize. Okay, thank you.
Thank you. Any other comments or questions? Seeing none, Commissioner, you're all set.
Thank you so much.
Have a nice day.
You as well.
Up next is the Department of Social Services. Commissioner?
They're all outside waiting to get in. They're all in uniform.
They're all EMS people. you know, you cut all their funding. They're all gonna go in. Listen. Good morning, Commissioner. How are you?
Good morning, Senator.
I don't know if you want to give a few words, and then we'll go directly into questions.
Yes, so thank you, Senator Austin and Representative Walker. Appreciate the opportunity to be here this morning. I am Andrea Barton Reeves. I'm the Commissioner for the Department of Social Services. And with me this morning, I have Nick Venditto, who is the Chief Financial Officer for the agency. I also have a number of subject matter experts that are here with me today from our department to answer any questions that you or your colleagues may have about our budget. And with that, we're happy to answer any questions you may have.
Thank you very much. Commissioner, a lot of my, a lot of my questions are relative to, Medicaid, and the funding for Medicaid. Now, the governor, in the governor's budget, he made some changes to some of the rate increases that we put out there. One of them, they're all here today, are the ambulances. And, you know, I think that that's something that Representative Walker and I spent a lot of time looking at last year and realized that we were going to start seeing some decrease in availability for some of the ambulance services. Some are handled by local fire departments or local nonprofit ambulance services. Some are handled by now more and more being bought up by hospitals. It's not necessarily a good thing, in my opinion, to have everything, all of our eggs in one basket, so to speak. Where do you see the rates going with the rate study and some of the other rates that we need to address?
Yes, so thank you for the question. I can address the history of the rates for the ambulances and then speak specifically to the rate study.
That would be great.
All right. So in 2021, as you mentioned, Senator, the Association of Ambulance Providers did ask for a 10% increase in rates and a $3 per mile increase in mileage reimbursement. And those actually were granted, and that meant that brought the mileage rate from 288 to 588, and then the 10% increase for the rates. So as you mentioned, in this fiscal year, there is an additional ask for a 20% increase to the rates and a 20% increase to the mileage reimbursement, which would bring it to $7.05 per mile. In our first phase of the rate study, we did cover behavioral health and primary care and dental. That was phase one. And we've delivered that rate study this month. In phase two, we will be looking at the rates for other providers. And it is in the context of that rate study, then we will be able to make a better, the way I will describe it is a better determination based on data of how other states are actually also paying, because that was really the purpose of the rate study, was in order for us to have a more orderly approach to the way in which we set rates, which is to have the study. So we are now going to be moving very quickly into phase two, because the next phase of that study is due in 2025 in January. And it's within the context of that rates not only for FQHCs, and I shouldn't say FQHCs, but other kinds of services that we provide will be studied in that second phase of the rate study, and that's how rates will be determined.
So what, if we had the dollars, the first rate study showed a significant issue relative to what we pay in comparison to other states. We're obviously far lower than other states in a lot of areas.
In some instances it did. The largest discrepancy that we saw in terms of the rates were with behavioral health. Right? And in some instances, compared to the 5-state comparison and compared to the Medicare, some were we were either on par, a little bit lower, some actually rates within codes were a little bit higher, but the largest discrepancy that we saw, the largest disparity, was within behavioral health. So the idea, I think, Senator, was for us to put some data around some of the thoughts or even speculation that we may have been engaging in individually and collectively about access and care and the relationship of those things to rates. So what this particular rate study showed us is that in some instances, and my rate study expert is with me here today, so I will ask her to come up with more specific questions, that particularly in the area of, let's say, primary care and behavioral health that I spoke of, primary care in some of the codes that we pay, we're actually paying pretty much on parity with the 5 states that we compared to, and within maybe, 5 to 6% of what Medicare pays. As I said before, the biggest disparity really was within behavioral health. And we see that that's the one area where we saw there was actually anecdotal observations about access to care that actually matched the disparity of the costs that we saw when the rate study was actually conducted. And that's really the point that we're trying to get to, is where we see things happening in the community and we think that it's actually related to access to care that's based on rates. That might be one aspect. It might be where the care is being offered. It might be the number of providers that are available. It might be the ways in which people can get access to that care. But it's an important indicator. And it's one of the ones that we see, particularly in behavioral health, that we think would need to make some adjustment. And now we have the data that shows that.
And if we had enough resources, what would the cost be to bring the rates to parity with the other 5 states?
Yeah.
Across the board?
Well, we have the $7 million. The rate study is the one thing I did not bring with me today, so I will actually got to
Oh.
bring with me. But I do have actually, maybe if you don't mind, I'll ask Nicole Godburn to come because she's lived the rate study to ask the more specific questions. Because there are many different levels of money that we would need to raise rates in different areas. So we can get you that data because we have it.
And nursing homes last year put a policy out there, the Department of Public Health put a policy out there that did not comport with the legislation that we had and created a cost for the state, which has not been paid out yet in our
Yes.
in our understanding of
That's
that.
correct.
Because the policy was put out there that did not comport with the legislation. The regulations were not passed. They were pulled because they did not comport with the legislation that we passed. Are we then barred from getting a portion of that issuance of a policy before the regulations were passed? Are we not going to get any of that from Medicaid?
Thank you for your question. It's actually a two-part question. So with respect to the path to actually getting the regulations and the policies passed, that would be a question that's better answered by Commissioner Gittani. So I don't know if I would necessarily answer for her in that respect, but to
I
answer
was
the-
actually making a statement there.
I'm sorry.
I
Okay,
know the
so-
whole thing.
but-
My only question is,
Yeah,
can we get Medicaid for some of the, for the costs that were incurred by the policy that was issued by the Department of Public Health incurs a cost, and you now have the responsibility to pay that cost to the nursing homes.
we do.
And,
yes.
and so are we going to get money back from Medicaid for that? Because it was a policy that was passed and then pulled.
Right. We can make the request, and there's only 2 ways in which we can do that. We can ask the Centers for Medicare and Medicaid, CMS, whether they will entertain a state plan amendment, which we call a SPA.
Yep.
And whether we do that now or when we've actually incurred the cost and actually have to pay it, the timing of that is always something that we discuss with CMS before we do that. So that is one option. The other option, which is probably less likely in this instance, is to actually apply for a waiver. But these services wouldn't necessarily fall within waiver services. There's usually demonstration waivers. They take 5 years, and you have to be a bit more planful about that. So the ways in which we can do that now would really be either to make a direct ask to CMS or to ask them if we can amend our state plan amendment. And they would have to make a determination as to whether or not these particular costs would fall within a SPA. So we would not know that until they've actually given us an answer one way or the other.
So have you asked the question?
We have not asked the question yet. We just finished closing the survey. So that's when we were able to determine the amount. We haven't paid anyone yet, but we do plan on asking the question.
And what are the costs that the nursing homes are asking for?
So at this point, the estimate is about $55 million.
And that would be if CMS says, none of that can come through Medicaid. That would be a total state cost
It would be a total state cost. In that
of
instance.
55, one-time $55 million. And the policy has been pulled.
That's
so-
my understanding. Yes, this
Okay.
policy has been pulled.
Uh,
Yes.
Thank you very much. Representative Walker?
Thank you, Madam Chair, and good morning. It's
Good
to see
morning.
you,
Good
good to
morning,
see you.
Representative.
I wasn't gonna ask this, but I just to continue a little bit with what my co-chair was asking. When each one of the agencies comes up with a policy that they feel it's important, is it communicated to all the other agencies that are going to be directly affected by it?
Sometimes it is, and sometimes we do have challenges in making sure that communication happens. It's never deliberate. I've never
Okay.
experienced that. It is often that we're deeply in the work that we're doing, and thinking about how it might impact another agency is something we often think about, but the actual communication sometimes, and I'm guilty of it too, doesn't always happen. With respect to this particular one, we did have an opportunity to speak with the Department of Public Health when they did implement the policies and walk through the regulations with them. We consider them extremely important partners to us, and we've worked very closely. I think we both learned the lesson of the integration of the policy and the cost. And that's something that we've had an opportunity to talk about in terms of looking back and thinking what we both could have done differently or better. So from our end, I think when we realized that the policies were being implemented, we certainly could have asked, do you have a sense of how much this might cost? Because there is a cost to it. And certainly I think our friends at DPH have also said when we're implementing policies, we now know the better thing for all of us to do is to come together and look at the impact it will have on the industry that the policy will impact, and also what we think the dollar amounts will be.
Thank you for that answer. I think we have that same question when we work in the General Assembly, because we need to make sure that we are touching base with everybody, and people understand that there's limitations to the, the allocations that we have to do for new funding and new policies. So it's very important that we all stay in touch with each other so that we're not saying, well, choose this baby over that. And sometimes that's what happens, like we see with education or OEC. So going on, last year we did the substance use disorder waiver. And I'm a little puzzled, but last year what we did was in 24, we reduced that 1115 waiver reserve account by $2 million. But then in 25, we are adding in an additional $16.3 million. Can you explain to me how that happens within this 1115 waiver?
Yes, I can. And I have my my chief financial officer with me as well if I misstep in any way. You'll see not just in this account, Representative, but you'll see in others that there have been adjustments that have been made that are reflective of additional costs because we may have underestimated the amount of use. And in some instances, you'll see some of our SIDs go down because our estimates were that we'd have a certain number of people availing themselves of a particular service, and that estimate has not come to fruition. So most of what you're seeing there is an increase, unfortunately, of the number of people who actually need access to substance abuse supports within the waiver. And we now realize that unfortunately is much, much higher than we had anticipated. So that adjustment was necessary as a result of that.
Thank you. And I sit on the opioid council, and that's something that I really I'm going to really focus on in going forward in the budget, because we do have funding, but I don't see a lot of coordination between the agencies in trying, how do we address it? How do we utilize the new monies that we're receiving to not maintain the level of addiction, but to reduce the level of addiction?
Right.
And so that's why I asked about this, because this substance abuse waiver is one of the mechanisms that I think we need to utilize. So I thank you for that, and I'll get to the end of the line, come back.
Representative Gilchrist?
Thank you, Madam Chair. Good to see you, Commissioner and
Good morning.
team. My two questions. The first has to do with the governor's proposal to reduce income eligibility for Husky A.
Yeah.
So wondering beyond the cost savings, are there reasons to reduce the income eligibility for Husky A?
Yes, so I think what you're referring to is the proposal in the governor's budget to move some folks that are on Husky A onto Covered Connecticut. All right, yes. So the reason for that is this: we are really the only state that provides Medicaid coverage for folks that have 138% of the federal poverty level as income. So we're actually an outlier in that respect. So what this proposal will do is it will move the income level down to 133% plus a 5% disregard of income and assets, right? So essentially the math still comes out to 138%, but we're calculating it differently because we're using income and then an asset income. We're using federal poverty level and an income disregard. So essentially and forgive me if I'm assuming something, but I think probably the question that's underlying all of this is what will anyone lose as a result of moving from one place to another, right? That's what it really is. And really, all of the coverage that a person would receive under Husky A, a person will essentially still get in moving to covered CT. And it also includes non-emergency medical transportation as well, right? So that's also part of Covered Connecticut. There is no cost sharing, there's no premium. So really what we're doing then is moving the vast majority of people who would fit into that category just into another category of insurance that's available. When this happened, when this was proposed a couple of years ago, there was no covered CT. So that meant that people would just be off of Medicaid and that would be the end of it because we were just going to lower the level of income eligibility and with no place for anybody to go. Well, obviously that was not a popular decision and that didn't happen. But this time there is a mechanism to move people so that we can be more in alignment with other states and then also have people have the same kinds of coverage that they have now.
And thank you for that. And would we be implementing any of the tools that were used during the unwinding to ensure that those folks get connected to the covered CT program?
Yeah, so I don't know if I describe it as the tool with the unwinding, but there is a tool that moves people from Medicaid onto covered CT, and so you have an entire year in which that transition happens, and you don't lose your coverage. You just move from one to another, and then you would then apply for covered CT. It's not as seamless. I'll just be honest. It's really just not as seamless as the person moving from Medicaid on to covered CT. We have that year, and in that period of time, they don't lose any of their benefits, but they do have to actively apply for covered CT. But because we will know who that population is, thanks to our friends at Access Health, they can help us identify in what we have. We can help facilitate that transition because there are some tax credit complications that go with being on covered CT that requires consent. So it isn't as if we can just move people over, but we have lots of tools, thanks to our friends at Access Health, that can educate people about that because they will essentially be moving to what is the equivalent of the silver plan in covered CT.
Great, thank you. And my second question has to do with the increased authorized count for 84 positions.
Right.
What are these positions? I guess I'll start with that and then I do have a quick follow-up. Yeah.
Yes. All right. So Nick, really, go ahead, Nick. You really want to answer this, so go ahead. Okay. So our count now is of last week was 1810. Actually, we're at 1813. So we still have a number of positions that need to be filled, particularly in child support and social work. Right? We are desperately in need of folks everywhere. We're also in desperate need of people in our program support area. So that really are the people that do LIHEAP and migration work. So we do have some areas that really need more individuals who have a lot of subject matter expertise and sort of the right educational and informational background to do the work. So those are the numbers that we're looking at to bring us back up to a little over 1,900.
Would you be able to bring to the working group a breakdown of maybe of child support, program support, the different types of workers?
Yes.
Got a few more, the amount they're paid,
Yes.
who you currently have versus where you want to go. And then I think it would be interesting to know from the point that someone applies, how long till they're hired? because I'm hearing that it's taking quite a bit, not just your agency, but across the board.
I'm happy to bring that to the working group, but I can tell you now, it takes longer than I think we would like.
Yeah.
And I know that Commissioner Gilman is doing a stellar job, but it still takes quite a bit of time.
Okay.
Yeah.
All right. Thank you. Those are my two for now.
Representative Dathan.
Thank you so much, Madam Chair, and nice to see you, Commissioner, virtually today. And thank you for your team for always being on top of answering questions. I have two for right now, because that's all I'm allowed. The first question is going to be resulting in Husky C. I know this is something we have talked extensively about last year, and it seems to me that what's in the governor's proposal is not consistent with what we have passed last year in our budget, where we passed the federal poverty in case after the income disregards. And it sounds to me, and I'd like to get to the bottom of this, that the governor's proposing to increase before the income disregards, which actually makes the income level much lower than intended and what the legislative intent was in last year's bill. If you can let us know what that is at the working group, we'd greatly appreciate this, because it does seem to be outside of the norm of what we're hoping to get through. The second point really is the waiting list. I received the sort of joint, I'm just pulling it up now, the quarterly report that was done on autism and IDD services waitlist in January 24. All we received for the autism waitlist was a single line item. It was on page 2, where it indicated that there was 2,047 people waiting for services under the autism waiver program. Really would like to get kind of the movement on this. How many were at the beginning of the year last year? How many were taken off, and how many were added? And I'd really like to get a breakdown and understanding what the services that these folks are waiting for. Is it housing support? Is it other sort of support? So that we can ensure that if they are being driven by, people needing services, that's a workforce issue. If people are waiting for housing, then that's another issue. So I really want to try to get an understanding along that, and also the waiver program for Katie Beckett. I know there's a bill that we're looking at to expand that, and we've added to that program. I think it was in 2022. I know Rep. Walker, Senator Austin will remind me, but it was in the last couple of years, and would like to see how we're doing with that waiver program, and also where we've added and taken people off. It is a very long wait list, and there are several people on that waiting list that are terminally ill and need services, and I'm very concerned that they're not going to get those services that they need in time. So if we can bring that to the working group as well, I greatly appreciate it. Thank you so much, Madam Chair.
Thank you, Representative.
Well, thank you. Representative Dillon.
Thank you very much, Madam Chair, and good morning, Commissioner.
Good morning.
Just to follow up on the question of that was raised by Representative Gilchrist. For the work group, I wonder if you could just provide us with maybe a one-pager, which I'm sure you've already done, on how the unwinding rolled out, because it's there was a question raised about the relationship between that and how seamless some of the other proposals will be. And I specifically asked that because it was my understanding that some of the unwinding was outsourced, and that it may well have been that the vendor actually didn't have enough Spanish-speaking people to staffers to make that work correctly. And I don't know if my impression is accurate, but I did hear reports in the middle of that people were trying to make sure that people had access to care. So you could comment now, but I would definitely appreciate it if you could provide that to the work group.
Thank you. I'm happy to provide that to the work group. The unwinding actually has gone quite well. We are one of the top 5 states in terms of our performance in the unwinding, and that has been determined by the Center for Medicaid and Medicare and Services. So we actually are quite proud of that outcome. I have not heard of any reports of individuals not being able to get access to services through the unwinding because of the inability to communicate and our inability to communicate with them because we don't have translation services. We use translation services today for all of the services that we provide. If someone calls or needs translation in one of our resource centers, we do have that available. So that is actually surprising. We do have some support through a vendor, but we also use many of our own state employees for unwinding as well. But I will bring more detail to the working group so that I can answer your question more completely.
Thank you, Madam Chair. Just a follow-up question on that. If you could, if you outsource any of the functions that we're working on, do you evaluate whether or not they have sufficient language translation capacity? Is that part of the RFP, or is there an RFP?
There is not an outstanding RFP as we speak for the unwinding, only because we're near to the end of it. But when it comes to any service that we may put out to bid, the ability to communicate with our members and those that we support is always a consideration. Whether that is language or having special equipment for those that are deaf and hard of hearing, we do always ask that question about accessibility.
Well, thank you, and thank you, Madam Chair. It may be that it was simply a bump in the rollout. I don't know that, but I look forward to the information. And thank you, Madam Chair. Thank you, Commissioner. Have a great day.
Thank you. Representative Paris.
Thank you, Madam Chair. Commissioner, good morning. How are you?
Good morning.
I'd like to turn our attention to Husky Bee for a moment, if possible. I have 2 questions pertaining to that program. It says here that the governor's his budget is recommending that we reduce funding by $14 million to reflect an anticipated expenditure under the requirements of Husky Bee. But from my understanding from constituents that I hear from often and advocates, the need for Husky Bee is actually much higher amongst those who would qualify for it. So if we're reducing so much money, can you tell me what the forecast is from your agency in terms of what that need will look like over the next few years, especially given the age constraints?
Thank you for your question. So Representative Paris, I think this will actually be good news I can deliver to appropriations for a change. It is actually not a reduction. It's a reallocation. It's a recategorization of the money from where it is into Medicaid, because we are actually paying for those supports out of the general Medicaid fund. So we've moved it from Husky Bee into that fund. So overall, if you look at our really our financial status, with the report from the governor, you will see we have an overall increase in our Medicaid spending. So we've just simply moved it from where it had been allocated to where we're actually spending it.
That's helpful to know. And I think as advocates, we'll try to increase the age in future sessions. It's really important to know how successful it's working right now. So thank you. My last question, Madam Chair, before I turn it back over to you. Commissioner, can you just give me an update on the maternity bundle in regards to Husky Bee?
Yes, I can. So our target date for launching the maternity bundle is September of this year. We are still waiting for CMS approval. They understand how important this is. We are trying to be patient, but we would very much like to see it launch, particularly because there is a huge and growing demand for access to doulas. And we know that that's part of the bundle. So as soon as we know what our approval is from CMS and a timeline for that, we will launch it. We're hoping it will be September, but we'll know better once we get final CMS say so.
Thank you, Commissioner. It was very good news on your part today. Madam Chair?
Everybody all set for the first time? Representative Johnson.
Thank you, Madam Chair, and thank you so much for your work. I just wanted to check in with you again on the Temporary Assistance for Needy Families Program, and I see that we are still going, according to the information I have so far, that will be in effect for the 36 months, beginning April 2024 this year.
That is correct.
And when I saw a little bit of a reduction, I thought, how are we doing with respect to the computer systems that were put together by Department of Administrative Services?
Yeah. So the reduction that you see really is not necessarily a reflection of any technical challenges that we're having. We're just not seeing as many people enrolled in the program as we would like. And we're a bit puzzled by that as well. So we're just trying to dig in a bit more deeply, particularly with our community action agencies, to see if there are ways that people can be directed to the cash assistance program also in concert with the other services and supports that we provide. So that's essentially what you're seeing.
Okay,
Okay.
great. Thank you so much.
You're
Thank you,
welcome.
Madam Chair.
Thank you. Senator Lesser?
Yes, thank you, Madam Chair, and good to see you, Commissioner.
Thank you. Senator.
Sorry, I was a few minutes late to your presentation. Just wanted to ask a question. I asked sort of a follow-up on a question I asked of Secretary Beckham. You know, you recently came out with the report on Medicaid rates, which found that Connecticut is far below peer states and Medicare. In fact, we haven't adjusted, as you know, adjusted our rates since 2007 in any wholesale way. And it's a miracle we've been able to stand up the Medicaid program. But your leadership is part of that. One question I sort of wrestling with, this report came out that suggested we need to put a whole lot of new money into the Medicaid program, but there is no new money in the governor's budget. So what's the plan? Any sense from what the governor is planning to do to help address that problem that you know the executive branch report shows?
Right. So thank you for the question. So there are two ways in which I can answer that. First, this is the first part of a two-phase rate study. So, and I would not propose to speak for the governor, but you know, if I were a person who was making a decision about what to do with respect to funding, I think I'd like to have the totality of information in front of me before I made a determination in one budget year or another. So what we have determined is, I think the more prudent thing to do is to complete the rate study in its entirety. So to figure out the second phase and to get the results from the second phase, and then make a larger determination as to where resources can go. We have $7 million right now, as you know, that state share that we could make a determination and recommendation as to where that money should go. But before we do that, we think it's very important for us to hear from our stakeholders and others, because we know the report is being very widely read. I get lots of emails about it, so I know that that's the case, and people find me on LinkedIn and have opinions about the report as well. So I know that it is in fact being read. And that's a good thing. That is what we want. But it also tells us that there are many voices that want to and should be heard before decisions are made about how we spend the $7 million that we know we have in our hands right now, and what other recommendations might be made with respect to spending in the future. So I am not making specific recommendations at this moment. Once we finish our stakeholder process for phase one, we will come back with some recommendations as to how we might best spend the $7 million that we have, and then launch into phase two, and then come back with more comprehensive recommendations after that.
I appreciate that. So, but does that mean that you think that will be in the governor's budget next year? Is that what you're saying?
I don't know. I
Yeah.
don't know, Senator. I'll just be honest with you. I cannot speak for the governor or the secretary and how that will be budgeted. What we've done in this first phase is that we have presented the results of the study. We have the resources that we know we have available right now, and it really is up to the governor and the secretary and his team to make a determination as to how those needs will be funded.
I would just say this is the biggest takeaway from the report that I got, and I you know, we don't know what's coming in phase two and whatnot, but the biggest takeaway that I had is that we are way late in addressing this issue. So asking for more time and it doesn't seem to work for me, because it seems like we've got a very serious crisis in the Medicaid program that we have to address, you know, expeditiously. And I know you know that, but I'm hoping that someone in OPM is listening, and that we can move quickly to address this issue, because I think it's, you know, a critical crisis in the Medicaid program. Thank you.
Senator, I do really appreciate your perspective, but I also think it would be remiss if I didn't just I'll just call it what it is, just give a huge shout out to all of the providers who are continuing to provide an array of services to all of our members. As you know, between all the services that we provide at DSS, we are serving more than 1/3 of the people who live in the state. And we have an enormous reliance on our Medicaid providers to do that. I probably have a little bit of a more rosier picture in having read the study. It isn't that with the exception of behavioral health, we are somewhere within, the 70 to 75% of what is being paid for Medicaid, for Medicare, and within the 5 states that we compared ourselves to. So I guess I don't see it as dire, but that doesn't mean that action isn't necessary. Absolutely agree. But I don't want to be discouraging of those that are continuing to provide really outstanding and excellent care to the folks that we need to continue to support.
Well, I thank the chair for the time, and I think we're going to be doing a joint hearing on Medicaid rates tomorrow. So
Yes.
I don't want to rehash all the stuff we're going to be talking about tomorrow, but thank you so much, and
Thank
I will turn it back to you, Madam Chair.
Thank you. Representative Walker.
Thank you, Madam Chair, for the second time. There is a reduction in several agencies that my co-chair and I are really concerned about. And I'll start with last year. In your budget last year, there was a reduction proposed in your IT department of
Yes,
75 positions.
that's right.
But the interesting thing was, in your last year's budget, it just had the positions and it didn't have any dollars.
That's right.
This year, it is now 66 positions, and now it's $33 million.
Correct.
So I guess I should ask this question. You are very dependent upon your access to IT systems because much of your services are done through Medicaid, CMS, your case management, every person in your agency has some sort of connection to IT. I'm not gonna ask you, because I wouldn't do that to you. I will just make a statement because the interesting thing to me was last year, it had no dollar amount.
Yes.
And this year, it has a whopping $33 million amount, which makes me very, very concerned. I think that we have to understand the importance of IT for several agencies. You're not the only one there. And my co-chair and I have been asking these questions over and over again. I'm very sensitive to it because I know how often I call your office and I get, well, we're going to the access and we get the information as soon as we can access the system and things are going to go and everything is sort of generated from your IT.
That's right.
It's going to be a long conversation that we're going to have with DAS and OPM about the importance of leaving independence in our agencies in order for you to run your functions. So I just wanted to make that statement. I know it was a question. Do I need to put a question in that, Madam Chair?
If she's not saying anything, no.
Okay, thank you.
I'm happy to answer the question.
I'm sorry?
I'm happy to answer the
Okay,
any
so,
question,
can you help me understand how that possibly, even though I'm not going to do it, but
You already asked her.
how, go ahead, answer, Commissioner.
Yes. Thank you, Representative. So as you rightly pointed out, there is a transition for all agencies of IT functions to be centralized within the Department of Administrative Services. And that centralization looks exactly the way you described it, that the positions that had previously sat in individual agencies now move to DAS BITS. And last year, the positions moved and we held on to the money. This is my colloquial description of what happened. And this year, the positions and the money are moving. And that's why you're seeing the $33.8 million. But there is a story behind that I would really very much like to share. And that story is about Mark Raymond, right, who is the state's chief information officer. So I think my experience with Mark is that he takes very seriously this responsibility of centralization. And there are essentially 2 paths that you can take when you become sort of king of this huge castle. You can decide that everyone is just going to capitulate to your will and they have to just take whatever it is that you offer. Or you can decide that these are your customers and you're going to work collaboratively with them and you're going to create a culture where people are being listened to and things are being delivered. I can say without question, Mark has decided to address this consolidation with the latter approach. So there are regular meetings that always happen with DAS bits. They ask us technically what's going on in one meeting. And I have a lot of meetings. These are two that I really don't mind going to. And the second one is always, how are we doing? What can we do better? What can we do differently? So while I can't speak for any experiences that other agencies have had, I can tell you that with this leader, he's very open, he's very receptive, he's very responsive to what it is that we need. And we've had very pointed conversations about, this is our money. You need to be accountable to us as to how you're using it and where it goes. And we need to be partners when you make decisions about how you're going to use it. But there has been an enormous degree of receptiveness to that approach. And in the little more than a year I've had this role, I've not found that to have changed.
Thank you, and thank you for that. I mean, I too know the gentleman, and I feel that he has every intention of trying to make sure it works. But the fear that I have is that we are dependent upon the IT system in every aspect of work that we do with the public. And when we have something that is that sensitive to be in one location, we saw the HR consolidation. And that was an absolute nightmare for all the agencies. And I'm not asking you about that one because I know
Thank you.
in the service, I know in the services and the complaints that we've gotten from the public about different things. So to me, I'm glad that you guys are collaborating. I'm glad you're working together, but I think that you need the autonomy to handle your own IT with the collaboration and the consultation from Mark and his department in helping you to run your operation. But it's the heartbeat of your operation and your delivery system. And that needs to be in the agency that it's working for. So thank you, ma'am. Thank you, Madam Chair.
Thank you. I'm going to go back to Representative Porter for the first time.
Thank you, Madam Chair, and thank you, Commissioner, for your presentation this morning. So good to see you. I just have one quick question. I wanted to know if you could give us a status update on the maternity bundle.
Yes.
What's going on with that?
Yes.
Through you, Madam Chair.
Indeed. So the maternity bundle is awaiting approval at CMS. We do plan on launching that as soon as we can. Our target date is September of this year. So we think that's a realistic timeframe given where CMS is in their approval of similar bundles with other states. They do know that we are anxious to get started. We are in constant contact with them around the bundle, but that is the plan.
All right. Thank you so much for that. And thank you again, Madam Chair.
Thank you. Representative Gilchrist for the second time.
Great, thank you for the second time. My question has to do with appeal referrals to the Center for Medicare Advocacy to recoup federal funds. If you don't have this information now, I would just love it to be brought to the work group. Being told that there's a significant drop in the cases that have been referred. And so it would be great if you could bring to the working group the breakdown of the last 5 years of appeal referrals, the amounts recouped, and then I'd love to see the staff in your agency that are dedicated to that work over the last 5 years.
Yes. Thank you.
And then I do have a second. Can I do a second in round two? Okay, thank you. Back to Husky A and the covered CT.
Yeah.
I am getting information from folks that there are certain things that don't transfer to covered CT, such as the caretaker relative. So typically a grandparent that's over 65 who receives Medicaid on Husky A, that they wouldn't be eligible for any federal subsidies on the exchange or covered CT. And then another example, Medicaid Community First Choice benefit, which provides extensive PCA services needed to keep people out of nursing homes. That's covered. It's not covered under the exchange and covered CT. So for the working group, it would be great to have a breakdown of what is covered on Husky A compared to covered CT so that we can better understand what that shift would look like.
Sure.
Okay,
All right.
thank you.
Happy to do that.
All set?
Yes.
Representative Dathan for the second time.
Thank you, Madam Chair, for letting me go a second time, and thank you again, Commissioner. I know we're going to hear more on the rate study, but I'm probably most concerned about what's happening with the behavioral health, and concerned that we're not tackling that because we are in a mental health crisis in our state. I know others have talked about it. I know we've talked about peer support services as a great mechanism for utilizing Medicaid dollars. And currently in our state, we only reimburse peer support services for inpatient versus outpatient. I know DMIS, there's a block grant, but within DSS, I think we're leaving federal money on the table that really could support our crisis that we're having in behavioral health. And I would say I'm probably most concerned that we're flat funding. We have, people who are sitting in emergency rooms for days on end because we can't get them a placement. So I am hoping that you can bring to the working group maybe currently how you're utilizing Medicaid dollars when it comes to behavioral health, and how we are looking to address that going forward to improve services and outcomes in our state. My second question really has to do with interagency kind of discussions. And I know we have been working with OPM to develop a plan for a portal. Has the DSS been involved with that process so far to ensure that all of our agencies are talking? It seems like from the work that we did in 5001 last year, we saw a lot of agencies were working in specific silos. I do have another question, but I am going to share that, I guess, with the administrator to ask later.
Thank you, Representative. I can address the second
Go ahead.
question and then bring the information to the working group. I can say I'm not necessarily familiar with a formal portal, but there is a Health and Human Services cabinet that meets monthly, and that would be the Department of Public Health, DSS, DMIS. And so the communication between the commissioners and among the commissioners is pretty consistent. And it happens formally, and it happens almost every day informally. So I don't know if we necessarily need a more formal mechanism for that communication to occur. But as I had mentioned in my response to the question that Representative Walker had posed earlier, this communication happens very regularly, and it is strongly encouraged by the governor. But even I think if he had not put this cabinet together, this particular group of commissioners has recognized that our work is very interdependent, and that having those relationships is essential to serving, in many ways, the same populations of people that we serve from one agency to another. So I know that at this point, I cannot speak for my colleagues, but we're always in communication. We are calling, we are emailing. So I don't see that to be the issue, and we have a good working relationship.
Excuse me. Thank you. No, thank you, Commissioner. It really wasn't in the aggregate how on a top level how things are working, but really on a more detailed basis for individual client. And I know there's HIPAA things that we need to be thinking about, but this is something that I have heard a lot from my constituents that, they're having to deal with multiple agencies, share data over and over again. So I'm really hoping that the agency is able to address that. Thank you, Madam.
Sorry, I misunderstood your question. Yes.
No. I think that was good what you had said, but I was just trying to take it one step further because I know this is something we passed in legislation last year, and it's due on the 1st of July. It's less than 5 months away. So I was hoping that we'd be a little bit further along, and was hoping that we'd have an idea for, or at least an outline.
Yes, you might be referring to my CT, and I'll find out what the status of that is.
All right. Thank you so much.
Thank you.
All set?
Thank you, Madam Chair.
Thank you. And so lastly, for the,
I believe-
yes, Representative Johnson.
One other question about the Medicare Advantage plans. And I wondered, do you screen them when they're also subsidizing the Medicare savings plans? Because to make sure that they have access to all the networks of services that should be available to anybody who's in the Medicare savings plan. I've had some complaints about that, and that kind of follows up with Representative Gilchrist's question in terms of the referrals to the Center for Medicare Advocacy.
Mhm.
And I think that we may be in a situation where people are put in danger because they think that they're in a Medicare savings / advantage plan, yet the services are not provided to the same extent that they would be if they were in a straight Medicare Medicare savings plan.
Yes.
And so I hope that we can take a look at that as well to make sure that we are doing the screenings and that they are not allowed, if they don't have the network capacity that would ordinarily be available through the savings program. So thank you so much for that. Thank you, Madam Chair.
Thank you.
Thank you. Anybody else? Okay, I'm just gonna wind up with a couple things. One, we did the rate study. We didn't ask for a total cost of the rate study.
Mhm.
Did we ask for a total cost of the rate study?
No, you did not, but we can certainly provide that by each area of
Yeah, that
that
would
was
be
covered by
helpful.
the rate study. We do
So if
have
we could
that.
get that,
Yes.
and we'll make sure that for any studies we put in this year that we ask for a cost analysis because apparently we're not detailed enough. And then a rollout plan to implement that cost.
Yes.
Because we need to have a rollout plan. So that's another thing that if we have to put it in the implementer, we'll put it in the implementer. And three, I don't know if I was strong enough on the ambulance providers. If you could come to us, how we're how we're going to be able to prop up the ambulance providers. If we're not going to implement a rate study for another 2 or 3 years, which it looks like that's what the plan is, we're going to have some. It's really why we did this was to make
Mhm.
sure that we were propping them up while we were going through this process. And we don't do things, Representative Walker and I don't do things willy-nilly. We really looked at this and said, you know, this is one of those areas that we're not going to have some ambulance providers stay in service.
Right.
And we're very worried about that as before someone gets to the emergency room, the people they're calling are the ambulance services to get them there. And so I think that that's important for us to look at. So, you know, having most recently had them truck me down to Bacchus Hospital because I slipped delivering the garbage to the garbage can. Couldn't be a better story. But it is not a better story. So I do think that that's important for us to look at. So if you could bring those to the working group, that would be
We
helpful.
will. Yes.
And thank you very much, Commissioner.
Thank you so much.
Have a nice day.
Thank you.
Why don't we take
5-minute break.
a 15-minute break? We'll be back in 15.
15 minutes.
While it's still good morning, we're going to start. Commissioner, how are you? So, Commissioner, I don't know if you want to, first, it's nice to see you. If you want to go over a couple of things ahead of time or dive right into questions. What would you like?
Well, I'd say first, thank you for this opportunity to obviously Rep. Walker, Senator Austin, and Eric, Senator Eric Bethel, and Rep. Nuccio in their absence, and everyone who's online. I thank you for this opportunity to come before you. I am 2.5 weeks on the job in this new role. So I brought, my team with me. I have my CFO, Mel Sparks, and subject matter experts behind us, and we've submitted our written testimony. And so we're ready just to jump into whatever questions that you may have.
Thank you. Appreciate that. I see, my first couple questions will be on juvenile review boards and youth service bureaus. So it's a little bit more money to the juvenile review boards, and the youth service bureaus are flat this year. Have you noticed any changes that need to happen in either one of those organizations?
No, I mean, we've submitted a plan for the work that we're doing there, and we're working those plans accordingly. So I think we just need to stick to the agreements that we've made in the past to make sure that we are honoring our commitment to fulfill whatever plans are stated. So I think we're adequately funded for that at this point.
And relative to the UCCs and the subacute crisis, the $2.5 million, is that enough to support the UCCs? You think that helps them out?
Yeah, we were really concerned about the transition. We needed some carryover funds to make sure that the providers were sustained during the transition. As we stand up the billing codes for the Medicaid process, we wanted to make sure that there was not an interruption in service and that the providers were made whole. So we think with the current budget allocated that we can do so adequately.
Thank you. Representative Walker.
Thank you and good luck. Good morning.
Good morning.
Still, yeah, good to see you, and I'm glad you got to the preliminaries. You did, I heard you did good. So I'm going to start with my first question, and can you tell me, in your agency, how do you communicate with all your caseworkers? How do they do their files and their case studies and everything? Because I remember we started about 2 years ago a new system that was developed for case management. It was kind of the 1F consent decree that said that we needed to have more centralization and management in that. Can you elaborate a little bit on that for me, please?
So our current system, that our case management system, is linked, and we are transitioning to CT-Kind, which is CWIS compliance. It's compliance with the federal government and the expectations that we have there. And there's been a lot of fits and starts, quite honestly, with that transition, but we are excited about where we are, and we hope to be fully compliant and this project completed by August of 2025. So our case management system is the vehicle through which all of our information is maintained. It's what we rely on for record keeping. It's needed in terms of data for federal requirements. So it is at the center of our work, and we're really excited about this new system coming on board. And we promise to have it done. That's it. That's going to be my mantra for
I think
for this administration.
I think you mentioned it in when you met with the nomination committee and stuff. And so that's what really sort of sparked me. And as I looked at that, and I know if you've watched any of the questioning that we've had, I have expressed my concern about IT consolidation. And mainly because, well, because Senator Austin and I, when we proposed, first proposal was for human resource consolidation and then IT consolidation. We felt that the human resource consolidation still had not been realized in its capacity. And so I have even more concerns about IT consolidation. And I'm not asking you any questions. I just wanted to know about your system. But we held out a few agencies because we knew that was the heartbeat of your communication system with all your staff. I think you have, what, 2,900 people that work for you, and DSS has 3,700, and DOT has, I forgot, the numbers are staggering. And to know that your IT system is what helps regulate their services and operations, it worries me to no end. And it also baffles me because last year with the consolidation, they proposed, I think 75, but there was no dollar amount. And then this year, there's, I think, $30 million coming out of your operating personnel operating systems or something like that. So I know how important it is for you in managing a population of people that really don't have a defined need. And OE is one area that you guys use that to help meet the needs of your kids between foster care and all of the others. So I won't ask any more questions. That was my 2 cents worth about why I do not support an IT consolidation for you or DSS or DOT or DMV, and I probably have a couple others, but I'll leave that one alone. So going on to my second question, last year I talked and I asked about quality assurance. How do you evaluate your programs? Because one thing we know, again, is that DCF and DSS, you contract out for people to do the services for you, to provide, to direct services to people. How do you oversee, and I asked this last year and asked for some Q&A on and how you manage it and who oversees it and how often do you evaluate it? Could you give me any sort of feedback on that? Because that was what we asked for last year.
Absolutely. And I'm going to start the conversation and then perhaps kick it over to Melanie to fill in some of the details and some of the plans that we're having that are underway already. First of all, I would say that we have what I would consider to be a robust CQI system that's in place. The problem as it stands right now is that our case management system is antiquated. So as we move to the new CT Kind system, the reporting capabilities will improve tremendously. We do have, we had last year, Chapin Hall come in. It's an outfit out of North Carolina that does, consultation and provides technical assistance to states, come in and do a robust review of our CQI system. And they really applauded us for the infrastructure that we have in place, and also identified, where there were some gaps. And so we're going to be using that detailed report, which we can make available to you for your review, to inform our strategies going forward to sort of close some of those loops. Part of the issue, I would say, under no uncertain terms, is the case management system. And so, but we've made tremendous strides. We have outward facing portal that now is available to the public, that you can go and look at some of our data. We have in each one of our offices an infrastructure of staff who work on quality assurance and continuous quality improvement issues, management of the data. We have now a robust system. In fact, 2:00 today, we're meeting with our quality improvement leadership team where we're sharing the data, and so that we're making sure that we're implementing, strategies to address, concerning issues that may come up as a result of the reports that we get. With respect to our service array, we do have a data system that we use that providers upload data in. We also have several quality improvement centers that work with some of our service providers. What we're trying to do now is to have a uniform way of collecting our data so that our system that we're using will be the one system where there would be consistency in reporting. So I can hand it over to Melanie because we're making some tremendous gains in terms of how we're approaching the data management and the performance of our providers, and
So
that falls under.
I can, what I'd like to know is if you could bring something to the working group
Mhm.
and then explain how we as legislators can be part of that process, because we've been asking for that information
Sure.
for a few years now. And so to make us comfortable with the system and to also provide any input that we might see, I think we have to figure out how do we blend the two bodies together, because a lot of our colleagues have talked about who is minding the store. How do we know these are the best systems that are there? So if you would bring something to the group and a proposal for how we can do this together, and not in 9 months or 12 months, but more current. So thank you very much.
We hear you, and we will do so.
Okay,
We
thank
will end that conversation.
That's
this
right.
year.
Thank you, Madam Chair.
Up next is Representative Gilchrist.
Great. Thank you, Madam Chair. Hello, Commissioner. Nice to meet you. I haven't
Nice
had the
to meet you.
opportunity, I don't think, but nice to see you. My question has to do with the STAR programs and then also placements. I believe there's been a movement over the last decade, 5-10 years to reduce the number of placements and have children more so with family and relatives. But focused on the STAR program, it's my understanding they're meant to be short term. And so to the working group, if you could bring the length of stay in the STAR program broken down by year for the last 5 years, that would be really helpful. And then when it comes to placements as a whole, so background, I chair the Trafficking in Persons Council, and now I'm part of the Gender Responsive Working Group with the JJPOC. And while I recognize the department's interest and hope and understand the value in connecting youth with their families, there are many youth for whom that's not an option. And so it's my understanding that many of the young adolescent girls, unfortunately, kind of go through a number of foster placements and then are running from these various groups. So just trying to figure out long-term, are there services we could actually implement in the state that would help these particular populations? So if you could also, to the working group, do you base various placements, STAR, but other programs on levels of care? Would love to see those various levels of care. Would love to understand the percentage of children and youth in placement settings over the past 5 years. How many substance abuse treatment beds there are for adolescent girls and boys in the state. How many beds in general for adolescent girls. So maybe I could follow up with Susan Keene, our committee administrator, with a breakdown of some things I'm looking for, if that'd be helpful, rather than having you jot it down.
Appreciate that.
Okay, thank you.
I appreciate you raising it. We are dealing with an emerging population and an evolving issue out there regarding mental health, and the system has to evolve. So we welcome the conversation, and we will bring all the materials requested to the working group.
Thank you. Thank you, Madam Chair.
Thank you, Representative Paris.
Thank you, Madam Chair. I appreciate it. Commissioner Designate, how are you? It's very good to see you. two questions. I want to start first with just in terms of the outlook of your agency. It's a big agency, it covers a lot of work across our state. It's a critical agency. I just want to talk about the transfer of the 30 IT positions, which I would consider and deem necessary for your work. What does that look like right now in terms of the hiring for your agency over the last year, and how does the transfer of these 30 positions affect your work moving forward?
So the 30 IT positions are already at DAS. It's the funding that's proposed to move over. And so that's more of an alignment in the budget there. But with respect to hiring and just in general, is that your question?
Yes,
you're
ma'am.
asking? Okay. So I tell this story all the time. We had, what I would consider to be the perfect storm in that there was, incentive to retire, which we anticipated about 300 or so people retiring. What we didn't anticipate was the massive turnover related to folks really just not wanting to do direct service anymore. So there were a lot of people who left the workforce,
Sure.
particularly the human service workforce. Long story short, we had over a period of 3 to 4 years, about a third of our staff turnover. And so what we're dealing with now, and due to the, what I would consider to be great efforts in a partnership with HR to get the hiring started and really start to fill some of those positions, we are just dealing, like most people in most industries, with staffing issues in terms of keeping people in the jobs.
Sure.
So we've made tremendous gains. We still have a little ways to go, but I think we're moving in the right direction.
I appreciate that answer. And with there being such a need for state positions to be filled, I hope that we will be able to do that simply for the children and families of our state, and to also help aid you in your work as you lead the agency moving forward. My last question is around behavioral health services. As you know, which I think we're all acutely aware of, it's a major crisis that we're facing here in our state, and I believe that it will only be amplified over the next few years. So you're leading us at a time where it's most critical. We've been in the legislature, we've been really focused on children's behavioral health services over the last few years. And I know that the department has as well, aside from the permanent funding for the 4 urgent crisis centers and the 1 subacute crisis center. I don't see any additional proposals in your budget for other programmatic expansions. So how does the governor's budget support your renewed commitment for behavioral health, which I'm sure is there? I just want to know the implementation around that moving forward.
We thank you. Thank you for that question and the attention on the crisis we're all facing in the behavioral health space. And we appreciate the partnership that we have with, all of our sister agencies, you all here, because it's going to take all of us together to try to figure this out. So the UCCs are up and running. There was a really good article that where Wellmore talked about the vast improvement that the UCCs have made in this space. We also have CCMC opened up the med psych unit that we have there. So we're really excited about that resource. We have, as you mentioned, the subacute, and we have an RFP out for a second subacute. So that will make a dent. We also opened up, because we were able to address some of the staffing issues, a unit on the PRTF, the South Campus. So that's additional beds there. We have what we would consider to be a working draft of a proposal that we could do within our resources that we have already within our resources to actually increase even more capacity. So we're in the process of developing that, and we're happy to bring that to the working group to discuss.
I would certainly appreciate that. And Madam Chair, I have another set of questions, but I'm going to stay on your good side and I'll wait for my second time around.
Senator Lesser.
Thank you, Madam Chair. Sorry, I was being distracted by another co-chair of this committee. I just actually wanted to follow up on a question from Representative Paris just about hiring efforts and staffing, particularly looking at, obviously interested in social workers, but also nurses, and particularly interested in a breakout for the Solnet facilities. So if you could provide that to the working group, that would be hugely helpful in as much detail as we can get out of you. And then Representative Gilchrist and I sent, on behalf of the Human Services leadership, we sent a letter to OPM in December expressing some concerns about a loss of services for IDD children. And I recognize that that is not strictly a DCF issue. There are other agencies that work in the space, and that's why we reached out to OPM on this. But I want to make sure that you have a copy of that letter and that you're able, in the context of the working group, to respond to the specific questions that we asked about that as well.
Absolutely. Commissioner Chef and I actually were on a call this morning, and we were talking about the need or our efforts to collaborate. So I welcome the opportunity to read the letter and respond.
Wonderful. Thank you. And the only other thing I would just say is appreciate, on behalf of the Middletown delegation, your moving past the earlier idea about closing the Middletown office. Thank you.
All set, Senator?
I was expeditious, Madam Chair.
I appreciate that very much. Two questions. One, the mission of the Department of Children and Families is generally children that are, this is a question, is the mission generally to handle children that are assigned to the Department of Children and Families for a variety of reasons?
Repeat the question?
Is the mission of the Department of Children and Families to handle only DCF related children?
So we, of course, intervene on behalf of kids that meet the statutory requirement for acceptance of a report due to abuse and neglect. We're proud to say, given the fact that we have the statutory mandate to treat children in the mental health and behavioral health space, we provide services to all children as deemed necessary and appropriate, according to our statutes. And we, as you know, provide a lot of funding in the service, and you don't have to have an open case in order to receive some of those services that we
So
fund.
statutorily, relative to children, you handle children that have an open investigation or an open case on abuse and neglect, and you also handle children who have behavioral health issues.
Correct. We provide funding for those children. Yes.
Okay, and oversight?
We don't have
Just
case
funding.
management responsibility for all of the children that we provide funding for. So if we have an open case, we contract out services, for example, to Caroline, who is the ASO for services. So we don't necessarily have an open case all the time.
So someone could be getting services through UCC and not have an open case with the Department of Children and Families.
Correct.
And that would be true broadly on mental health
Correct.
services.
Correct.
Thank you. Because every time someone talks about another mandate that we're putting on the Department of Children and Families, already handling a lot of problems relative to children. I worry that how we're giving one more responsibility to DCF. You're in one of those agencies that's a no-win agency. You're not making everybody happy in every case. Actually, most cases have at least one or two parties that are unhappy with the Department of Children and Families. My second question is relative to ICWA, the Indian Child Welfare Act, which we worked with. We passed that law and is now codified in statutory language in the state of Connecticut. And I've been talking with the three that are only state recognized. The two federally recognized tribal nations are also state recognized, but have a different mechanism. So have you met with, not you, your agency met with the state recognized tribes recently to sort of go through that? And if not, would you be willing to do so or have someone in your agency meet with them to go over the ICWA bill and make sure that any concerns they have are being addressed?
We do have someone who is appointed to the tribes and has regular conversation. I haven't had a recent conversation to see how long ago that was, but we do have an established relationship. And we are always welcome. We are always open to meeting with the tribal community to work out any issues that need to be addressed. So.
Because the Eastern Pequots, which is where this bill generally came from,
Mhm.
having their chairman not know he was Native American until he was in his 20s after he had been adopted, and have said that there hasn't been a recent communication. So I would just ask that if possible, someone reach out to them. I know that Valerie Gambrell is their contact person who was a state employee back in the day, but she is the main person to talk to, although that might be more proper to go through the chairman, Mitchell Ray of the Eastern Pequots. So.
We're actually well prepared to do that. We just updated our policies related to the new law. And we have an identified point person, and we have forums that are getting up and running.
Thank you. And if you wouldn't mind keeping me in the loop on that, I would really appreciate that. Thank you. Representative Walker.
Thank you. And just to also let you know, I believe Valerie's also on JJPOC. So they're both members of the JJPOC. So you have another way of having an intro to them. They work very hard with our kids, and I like what they're doing, especially for mental health. They need to make that collaboration. So tell me, I don't know if anybody asked, and I apologize. We're trying to plan our day because we have 266 people that are going to be testifying. So if you do 266 people times 4 minutes each, that's about 17 hours of public hearing that we are trying to get people to help with. So we're trying to work that calendar out for everybody. So that's our problem. Feel free to join us anytime during the day.
Ben will be here.
Bring cake, cookies, potato chips, anything like that. But anyhow, okay, so question. I don't know if anybody asked, but do you have any wait lists on any of your services currently right now?
So we anticipated you asking that question.
I'm consistent. I'm consistent, so.
We appreciate that, right? So I'm gonna let Mel.
Hi, Mel.
Sure. Hi, Representative. We will have specific data for you at the work group, but I can say, as we're gathering that data, as you've heard before, DCF does not traditionally, for the bulk of our services, keep wait lists. If a service that we refer to is not available, we will find an alternative service. But what we are gathering is data around referrals. And referrals served and referrals not served, and the reason why. We'll have all of that available at the work group. But I do just want to say, as I'm synthesizing that data, what we're really finding is that referrals not served has less to do with available capacity and more to do with the ongoing staffing crisis and the difficulty that our providers are experiencing, similar to us, in recruiting people to do this work.
That is very true. I mean, I've heard it from almost every social service agency in the state and an educational agency. We're struggling. We're struggling with that. And what about the one of the areas, I mean, ICAPS is one, so that'll be, Child First is another, that'll be one. I'm trying to think. There was another one that I've been looking at. So what I'll do is I'll try and get to you the programs that many of us are looking for as far as the wait list is concerned.
Appreciate that.
But I appreciate your honesty in your answer, because staffing is huge. Hence, I didn't like human service consolidation, but that's a whole nother story. My next question is about I think someone asked about the Star Homes. Did you ask about? Okay, so we got that coming. And emergency stays for the Department of Lands for children that are DCF committed. Can I get those numbers too? Okay. Was there anything else that I had? Oh, my other one.
Can you clarify
Emergency-
emergency stays in hospitals?
Yes, yes.
Okay, urgent.
Urgent care.
Urgent care, emergency room.
Yeah.
Emergency room, okay.
And my other one that I always ask, are you lapsing any money?
We are not currently projected to lapse a significant amount of money. We do have, and this is only our 6-month numbers, we do have 2 accounts that are projected to be in deficit. And
Which
we-
ones are those?
PS and OE. OE significantly.
PS and OE?
PS and OE. I do think that the PS projected deficit, it's less than $100,000. That'll resolve itself, I believe, by the end of the year. OE, we are projecting an over $1 million deficit at the moment.
Okay,
but-
that's before any, yeah, okay, correct.
And we do have, I do believe we have the funds to cover that in our other accounts.
Okay.
We are currently projecting a possible surplus in board and care congregate. So that's our congregate stays. But like the commissioner said, we are working on a proposal that will bring to work group for behavioral health congregate overall. That will impact our projected surplus.
Okay, okay. I guess that's 2, so I'll shut up again.
Senator Lesser.
Thank you for the second time, Madam Chair. Commissioner, there was a recent report from the Child Advocate about a tragic incident that came out with a number of recommendations for the department. I don't know if the department has a position on those recommendations, and would they have a budgetary impact that we should be aware of?
We are working with the Child Advocate on their recommendations. We meet regularly. I think we have a shared understanding. There are minor things that we are negotiating in terms of some of the recommendations, but in general, we are working together. I don't anticipate any budgetary impact to the recommendations that are made. I think we'll be able to handle whatever we need to implement within available resources.
Okay, great. And then just briefly, and I'll defer to members here who are on the JJPOC or may chair it. There have been some recent conversations about CJTS, and I just was curious from the department's perspective, have there been any developments that we should be aware of, or any? I understand it's used for administrative purposes at this point only, and for storage. Have there been any MOUs or any new developments involving that facility that we should be aware of?
Nothing formal.
From DCF, obviously. I'm not
Yeah.
asking you about other agencies.
Got it.
Yeah.
So we are using a few of the buildings. We have our part of our IT operation handled there, and our drivers, some of our drivers are there. And we pay for the upkeep and maintenance of the buildings. But there have been no formal agreements with any other agencies for its use to date. There's been a lot of conversations though.
Okay. And I think there was a request to provide that information to any. We'll check offline, but we may have a request of just sort of related to those conversations to the extent that we can ask for that working group. But I'll circle back with my OFA team too. Thank you.
Sure.
All set, Senator?
I am all set, Madam Chair.
Anybody else have anything else? Representative Walker, do you have any more questions that you want to ask?
Just, thank you, Madam Chair, and just what I'd like to explore, what are we doing for the substance abuse issues that are with our children? What types of programs are you using for referrals? We had the portal open under the opioid committee, and I'm looking for programs that we should be looking at that we could fund with some of the dollars that we've got. And I don't know, in fact, we're I'm having a meeting today to find out what programs possibly were suggested for substance abuse issues with families with substance abuse issues and things like that. So whatever you got now, we'd like to know about. And then maybe we talk about, if you heard some ideas about some of the programs that we should be looking at to fund.
Appreciate that. There's a huge need for collaboration around this. As you know, it's an evolving space for a lot of us, and we're trying to get our arms around how best to keep our kids safe and support our families. So we're happy to bring whatever information you need so that we can work together to try to figure out how to address this issue.
Thank you, and maybe we can get some of the members from the opioid council to join us in that conversation, so we can have a little bit more collaborative conversation about it. So thank you.
Appreciate that.
Thank you, Madam Chair.
Thank you. Any other questions? Well, we're all set then, Commissioner. Have a nice afternoon. You're out of here early.
We are. Wow.
Thank you.
We're closing this part of our hearing today.